Imagine a life where every day is a struggle, where simple tasks like brushing your teeth or making breakfast becomes an uphill battle. This is the reality for many suffering from myalgic encephalomyelitis, also known as chronic fatigue syndrome or ME/CFS. In Sweden, these individuals often find themselves lost in a healthcare system that struggles to meet their unique needs. Consider the case of Karin, a 42-year-old woman living in Stockholm. At the peak of her career, Karin was struck down by a mysterious illness. She was constantly exhausted, with pain coursing through her body and cognitive difficulties making her work impossible. After numerous visits to different doctors, she was finally diagnosed with ME/CFS. Karin's struggles didn't end with her diagnosis. Her primary care provider, like many others in Sweden, was overwhelmed with a high patient load and could not devote the time necessary to fully understand her condition. Karin was left feeling unheard and invalidated, her symptoms dismissed as psychological or exaggerated. This is not an isolated incident, but a pattern that repeats itself across Sweden. ME/CFS patients are often referred to primary care, where doctors are overworked and under-resourced. The conveyor belt approach of these clinics means patients like Karin are not given the time and attention their complex condition requires. ME/CFS is a debilitating illness that needs a multidisciplinary approach. It requires the expertise of neurologists, immunologists, and endocrinologists, among others. But in Sweden, these specialists are often out of reach for patients like Karin. The primary care system is not equipped to handle such complex cases, leaving patients feeling neglected and unheard. The struggle faced by ME/CFS patients in Sweden is a call to arms. It's time for a change, time for a healthcare system that listens and responds to the needs of these patients. It requires a shift in attitudes, from viewing ME/CFS as a minor inconvenience to recognizing it as a serious, life-altering condition. So, how can we make a difference? By raising awareness about the struggles faced by ME/CFS patients, by advocating for changes in the healthcare system that would allow for more specialist involvement, by demanding that ME/CFS patients receive the respect, care, and understanding they deserve. The road to change begins with understanding. It's time to shed light on the struggles faced by ME/CFS patients in Sweden and push for a healthcare system that can truly meet their needs. It's time to stand up for patients like Karin, who deserve better care and a better quality of life, because no one should have to struggle alone.